He is the Salina Family Healthcare Center, Smoky Hill Family Medicine Residency Program. Welcome. Good to see you again.
Thanks. Thank you. Thank you, Madam Chair, and thank you, Committee, for allowing me to stand and speak in favor of Senate Bill 38. I did provide some written testimony as Senator Schmidt introduced me. I'm Rob Freelove. I'm a family physician. I'm the CEO of the Salina Family Healthcare Center, an FQHC in Salina, Kansas. And I'm also the program director of the Smoky Hill Family Medicine Residency Program, which has a focus on training family physicians for rural Kansas. Puts the highest percentage of graduates in rural Kansas of any program in the state of Kansas. My written testimony has some things in there from those two points of view, and I would refer you to that for the sake of time in those regards. But my comments today, I want to speak as a family physician. My dad has taught me a lot of lessons in life, and one of them is when you're faced with a tough decision, if it makes sense financially, whatever other reason, and it's the right thing to do, then that decision has made itself. Sheldon spoke rather eloquently, and I'm sure Randy will too, about some of the other reasons that this makes sense. I want to tell a couple of stories about why it's the right thing to do. I shared last year a story, and it's in the written testimony, about a 37-year-old woman, patient of ours, who had two jobs. Worked part-time waiting tables at a restaurant, full-time at a convenience store, who didn't have health insurance, couldn't get it through her jobs, worked two jobs, mother of three, who had a breast cancer. She waited about 6 months to come in and be seen for that breast cancer because she was worried about the cost of getting care. By the time she came in and had eaten through the skin, and the reason really she came in was because she was waiting tables and somebody asked her what the smell was. They could actually smell it. And that's what prompted her to come in. We were able to get her the care she needed. She had it excised, she had treatment. She's cancer-free to this day. So a happy ending. But at what cost? At what cost? If she had been able to come in when it was the size of a pinhead and we could have just excised it there in the office, all the pain, the suffering, the expense, that could have been saved. I have another story very similar. 32-year-old woman, which is really young, mother of four, worked full-time at Pizza Hut. Worked full-time at Pizza Hut. Didn't have health insurance. After about her fourth or fifth trip to the emergency room for recurrent bouts of abdominal pain, a large mass in her colon was finally discovered. She was admitted, she had surgery, it was cancerous. She was supposed to have chemo and radiation and follow-up. Didn't have health insurance, was all set up, there was no payer, she couldn't afford it, she went without it. She's back at work, waiting for her cancer to come back, scared to death that it will, because she can't get the adjuvant treatment to help prevent that. And then my last story is about Bill. Bill's 52. He works odd jobs. He's a handyman. Doesn't have health insurance. Can't afford it. Has diabetes. Tries really hard. He really tries hard to take care of his disease. But it's hard when you're on insulin. And insulin costs a lot of money. And you don't make very much. And you don't have any insurance to help you get that insulin. Unfortunately, diabetes is one of those, if you don't control it, you're going to have complications. Bill was admitted to the hospital just a couple of months ago. He came in with chest pain. Turned out he was having a heart attack. 3 weeks later, hospital-acquired pneumonia, heart bypass. He walked out of the hospital, probably not really able to do what he was doing before, facing a crushing mountain of medical debt. And still unsure of exactly how he's going to be able to manage not only his diabetes, but now the 5 new medicines that he's on for his heart disease. All of those people would have qualified for coverage through expansion. Every last one of them. In fact, of our uninsured patients, 82% work. 82% work. 83% would qualify for coverage under expansion out of all of our uninsured patients currently. If hearing that doesn't make you understand, that doesn't impress upon you how important this is for those people, I don't know what will. To me, this is the right decision. Expanding Medicaid, helping those people. We're talking about people in their lives. It makes sense and it's right. So I'm just asking you to do not only what makes sense, but what's right. What's right for Kansas and what's right for Kansas. Thank you.
Thank you, Doctor. Next we have, okay, we don't applaud in our committees, I'm so sorry. Okay, Randy Peterson, President and CEO. We don't boo either.
Thank you, Senator Schmidt, for that no booing. And thank you for opportunity to speak to the committee on Senate Bill 38, and on behalf of the Kansas hospitals that serve communities 24/7, 365.